Welcome and thank you for standing by. At this time, all parties are on a listen-only mode until the question and answer session of today's conference. At that time, if you'd like to ask a question, please press star one. Today's conference is also being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the meeting over to Dr. McKeon. You may begin.
Hello. This is Richard McKeon. I'm the branch chief of the Suicide Prevention Branch, and want to welcome you to this call. And this is a technical assistance call to provide you with important information that you can utilize in applying for one of the Garrett Lee Smith State and Tribal Youth Suicide Prevention Grants. So we will be walking you through some of the important information that's contained in the request for applications, and there will be questions and answers at the end. Let me just set a little bit of the context for you, because some of you may be aware that these grants have been redesigned from the way that we had done the Garrett Lee Smith State and Tribal grants earlier. And they, for the first 9 years or so of the Garrett Lee Smith grant program, the grants were smaller and not as long, and so that has been a change, but there was a very important reason for the change, and that really has to do with the challenge of doing youth suicide prevention effectively. While we were very heartened to learn from our suicide prevention evaluation that we had evidence that the Garrett Lee Smith grants were helping to reduce suicide among youth in counties that were implementing the program, there were a couple of things that still concerned us. One was that while this impact was able to be demonstrated in the year after the activities, it had dissipated. It was no longer present in the second year. So what that said to us was that important life-saving work was being done, but that we were still struggling to figure out how to sustain those efforts in states and tribes across the country. In addition, we also found that in looking at the national data, that we've not yet been able to reduce youth suicide across the nation, which obviously is our goal. So while we are having an impact, it is not enough. So that was the reason that we redesigned the grants. It was not to indicate that what had been happening before was not valuable. Indeed, we felt it was valuable and life-saving, but that more needed to be done. So that was the reason that we made the grants larger, with more funding, and we also made them more ambitious. And it is more ambitious for us and for you if you should be awarded these new grants this year. We will work closely with you to try to make your efforts within your state or within your tribe as powerful as possible. So that's an overview, and some of the context I hope you'll keep in mind as you go through the nitty-gritty of the application. You know that SAMHSA's mission to reduce substance abuse and mental illness across all of America's communities has suicide prevention as a very core component, and that it is multifaceted. And what you should see in front of you at the moment is SAMHSA's strategic initiatives. While suicide prevention is formally part of the first strategic initiative on prevention of substance abuse and mental illness, there is important links between suicide prevention and trauma and justice, about military families. Clearly, engagement about health reform and data quality and outcomes are something that you will find are very strongly incorporated into the RFA as well. And so with that, I am going to turn it over to Commander Christina James, who will take it from here, and I may speak with you later when we get to the questions and answers.
All right, thank you so much, Richard. I am joined in the room with Dr. Carnes, who is also part of our state and tribal team. We're going to go through some of the information about the RFA, and as Dr. McKeon mentioned, there will be a question and answer at the end. So these awards are cooperative agreements, and this year we are funding approximately $8.6 million in GLS state and tribal grants. That's estimated to be about 12 awards. The award is, you are eligible up to $736,000 per year for a 5-year term. The age bracket of this youth grant is ages 10 to 24, and with this year's grant, you must address the entire age range. We're going to go over this again later. The previous GLS cohorts were able to pick the age bracket between 10 to 24 that they want to focus. And that is no longer an option. You must address the entire age bracket. And applications are due June 2nd, 2015. It's at 11:59 p.m. that grants.gov will, Eastern Standard Time, that grants.gov will close your ability to submit an application. So my suggestion is to log on to the system well before the 2nd and make sure that the system is working for your agency. At midnight, that system will close and you will no longer be able to apply. The eligibility for the grant, which is listed on pages 19 through 21, for state agencies, you're identified as the lead for suicide prevention. Our federally recognized tribes and tribal organizations, including urban Indian organizations or U.S. territories. And you may submit with combined territories, with one territory serving as the lead. Previous grantees are eligible, but currently funded grantees are not eligible. So if you are in years 1 and 2 of your GLS grant, you are not eligible for this year's funding. Grantees in a no-cost extension are eligible. You may apply for this cohort. Some of the questions that we often get is, can a state or tribe apply from the same state? Yes. Tribes are their own sovereign entity and can apply even if they are completely enclosed within one state. Each state can only submit one application, so you cannot have a state with 2 applications even from different agencies. It's only one per state. And states and tribes are competing for all 12 funded application slots. We don't have a set aside for states or for tribes. Here's an overview of the Garrett Lee Smith Memorial Act. This is the legislation that guides our funding. You can see our funding goes back to fiscal year 2005. Last year was our first year of the redesign in 2014. We've had $17.7 million and funded about 24 awards. Since the inception of GLS, we've had 98 grantees that received funding. All 50 states and the District of Columbia have been funded. We've had 46 tribes and tribal organizations and 1 specific jurisdiction. As you can see, some of our grants have been funded. If you're adding up the numbers quickly in your head, some of our grants have been funded multiple times. The Garrett Lee Smith grants focus on goals 4 and 8 of the national strategy, which is the development and implementation of the community-based suicide prevention programs and to improve access to community linkages within mental health, substances, and abuse services. Your application should also be guided by your statewide or your tribal suicide prevention plan. You can also include that plan in your application. We have a campus program that is a 3-year program, which is $102,000 per year. Currently, they have 38 in their 3rd year, 22 grants in their 2nd year, and 15 in their 1st year. As part of your state and tribal grant, you are required to give 5% to an Institute of Higher Learning, and many of ours partner with some of the grants that have been funded through Garrett Lee Smith campus program. Which brings us right into the grant requirements. So 85% of your grant is for direct services. This is required by the Garrett Lee Smith Memorial Act. 5% of your grant funds will go to an institution of higher learning. You also must have informed, active parental consent. This is for all activities used in your Garrett Lee Smith program. You must have a public and private coalition or partnership. This does not have to be created new for your Garrett Lee Smith Act or for your Garrett Lee Smith grant. You can be a part of an existing coalition. You will also need to participate in the National Outcomes Evaluation. Part of that evaluation includes early identification, referral, and follow-up. This analyzes your service linkages for youth identified at risk. It's really the culmination of our Garrett Lee Smith grant. The goal is to identify youth early, refer them for services, make sure they're getting those services through follow-up care. There's a training, utilization, and preservation, and the training exit survey. These instruments will analyze the effectiveness of your trainings that you do throughout your state or tribe. As Richard referred in the opener, that we're only seeing an impact in the 1st year that a Garrett Lee Smith is no longer in a community, and the data from these trainings are helping guide our efforts to showing an impact in years past the 1st year. You'll also have a referral network survey, and this is going to analyze your partnerships. Your collaboration and partnerships are crucial to your grant, and understanding how they fit into the big picture of your grant is done through the referral network survey. You'll also have the prevention strategies inventory, and this is a way for you as the grantee to look at your strategies on what you've completed and how they fall into your overall goals and objectives. It's also a way to have peer sharing to see what other grants across the cohorts, what kind of strategies they're using for their grants. One of the frequently asked questions is, when does this project period begin? If you notice on your RFA, the anticipated start date is September 30th. Our grants often follow the federal fiscal calendar, but that has not always been the case. We've had some that were funded in early August and late July. But generally speaking, the cohorts follow a fall fiscal schedule. And of course, all grants will have to be awarded before October 1st. Again, as Dr. McKeon mentioned earlier, we've had a program redesign last year. So for 2005 to 2013, you could have your choice of your age to focus on in the 10 to 24 age bracket. This is no longer the case. You must cover the entire age range, and please be specific as to how you are going to address each age bracket. You could ask for funding between $544,000 for 3 years, and we are now at $736,000 for 5 years. We also had Gatekeeper Training, and partnerships with their health systems were encouraged, but were not required. And now your Gatekeeper Training really has to show the impact that you're making and the follow-up with the emergency room, so your continuity of care, and able to for you to be able to have a effective continuity of care, you have to have a good surveillance data system set up. The idea is that you are learning where your youth are having attempts and deaths by suicide, and that you are working with the agencies in these areas to find out when youth are referred so that you can follow up and have, especially within that first 72 hours where youth are at risk after an ER visit or inpatient care. And this, with the redesign, you must work with a behavioral health provider. And ideally, you're working with them in all of your communities of focus. Several of you have written about what is meant by direct services. So direct services is a broader definition with your gatekeeper or clinical training, screenings, referrals, and follow-up, and post-vention support to survivors. The participant protection is in Appendix 3, and that can guide some of your work. Garrett Lee Smith requires active consent, and that would be included in your application. So the next question, but can we use the grant to pay for direct treatment services? And this is a yes, but. It depends on how that direct services is defined, and you can see on pages 4 and 5 where we're talking about direct treatment. So we do not typically pay for a direct treatment into a mental health facility. Even with the increased funding, that would eat up our budget very quickly. So you cannot find a mental health facility within your area of focus that is already doing suicide prevention work and simply give them more money to continue work that they were doing prior to your GLS grant. It must be part of a more comprehensive plan, and the things that we typically do see this treatment services funds go towards follow-up services, risk assessment, and monitoring of clinical care. So things like case management and MOUs with the mental health services for services in the 10 to 24 age bracket. So other features of our redesign, we now know that there's this connection between serious mental illness and mood disorders with suicidality. So that's a definite risk factor for suicide attempts and death by suicide. And we need to, as identified on page 9, you need to focus on their assessments and their access to care. There's also specific mention to the NSFP, on page 9 of the RFA, so the National Suicide Prevention, National Strategy for Suicide Prevention. I couldn't remember that word strategy there for a moment. So you must use surveillance data to inform and improve your efforts. And I hope that you have heard me use the word surveillance data several times now in this webinar. It is a crucial part of your application. Crisis response plans are required as well, and ER discharge follow-up is required. So your surveillance data, remember, is informing all of these efforts. And then your crisis plan is going to be put in place, and your follow-up plans will all be put in place. You have to incorporate lethal means restrictions for those that are identified within your area, and your public awareness campaign must be connected to behavior change. So not just identifying the message, that message was able to create behavior change within your area. Also on page 10, you're required to have youth council feedback. So you're required to have youth as a part. It's a youth grant, and your youth should be actively engaged in this grant, giving feedback and input into how your grant is going to deem a success. The same goes for the loss of attempt survivors. You have to have their involvement and their feedback as well. Having them as part of your coalition is usually a wonderful idea in getting this feedback. You can also look at additional sections of NSSP. You can include them as you see fit, but the ones that were mentioned are required. As you read the RFA, you'll also see the communities of interest. So, for example, youth that are at higher risk, like those that are in contact with juvenile justice systems, foster care. You make sure that you are utilizing appropriate materials for these specific populations. So it is not one program that is going to be a blanket for the entire state or tribe. Data and outcomes, you'll have data measures that are reported on a quarterly basis. These are, the ones listed are additional data points for your grant. You will go through organizations and collaborating, sharing resources. You'll document your policy changes. This is not to say that you will be in any way lobbying as a part of your grant. That is not allowed as part of your Garrett Lee Smith grant, but you are able to help inform change. Organizations demonstrating improved readiness to change their systems, that definitely goes into your policy changes, and organizations that now obtain, analyze, or utilize mental health data, and organizations that implemented mental health practices, communities that establish systems to share service deliveries across the agencies, and advisory groups to our consumers or family members who are suicide survivors, and individuals contacted through program outreach. So these are all as a result of your grant. These are not activities that were already in place that you can count as part of grant activities. If grant funds were not used to change a policy or to work with these organizations, these are not numbers that you can include in your data and outcomes. The basic structure of your grant application, you'll have a face page, which you can see in PHS 5161-1, your abstract, which is 35 lines, your table of contents, and your project narrative and supporting documentation. This is really the bulk of your grant, how you're going to do what you say you're going to do. It's 25 pages in sections E through F. You'll have budget forms, which is also located in PHS 5161-1, your attachments, assurances, certificates, disclosure of lobbying activities, and your checklist, which is PHS 5161-1. Just a reminder that all of these components are due by June 2nd, 11:59 p.m. Eastern Standard Time. You'll access this in grants.gov, and if you are late, you will be ineligible for review. So it is recommended that you log into the system, again, well before your June 2nd deadline. Tips for managing the grant writing process. Begin with an outline. Match the required info in each section. And if we asked for it, don't hesitate to repeat the information in different sections. The items of this grant that are very important to SAMHSA that we feel will make an impact in suicide prevention are listed multiple times. It is completely appropriate for you to mention it multiple times as well. Please pay specific attention to the points in each of the review criteria. You'll see how your grant is being graded based on the review criteria. In Section A, there's the population of focus and statement of need. So why do you need this support in your community or your communities? So you're going to describe the pattern of youth suicide locally and identify a target population and the rationale. So whatever population you choose, please describe why that population is where you want to focus your efforts of your GLS grant. You're going to connect the needs identified in your suicide prevention plan. Remember, each state is going to have a plan, or your tribe will have a plan, or you can have a community readiness assessment. It's going to be attachment 4 of your grant, but you really want to tie your population, the needs of your specific population, to the plan and the readiness assessment. Provide comparison data to add contrast and depth to your needs statement. And then any visual aids that you want to use, please make sure that you describe what it is that you're looking at in the table or the graph and how it relates to the impact that you plan to make. Section B on proposed evidence-based practices is on page 25. This is what are you going to do? What is your plan with the money that you are requesting? You are going to draw from your best practices and evidence-based practices or other interventions. So if by chance you would like to use something other than a best practice or an evidence-based practice, please give an explanation as to why it is that you are using these programs. And then with your best practices programs or your evidence-based programs, please describe why that is the best one for your community. You can check out NREP, which is SAMHSA's System of Evidence-Based Practices, and the link is provided at the end of this webinar. You can also use the Best Practices Registry, which is located on the SPRC website, and that link is also provided at the end of this webinar. As I just stated, evidence-based programs may not exist for the program that you are trying to have in your state or tribe, and then it would just be necessary to explain or to justify what you want to implement and why it is that you've chosen this specific program. How does this practice address the need of suicide prevention in your community? You'll need to provide evidence or support for why this is going to work with your particular focused community. Explain any modifications that you think will be necessary for you to have success throughout your grant, and how your proposal addresses the population you're focusing on. You can include your logic model. As you can see, this is a lot of programs that we're going to use agencies throughout the state or the tribe, so it's best to work collaboratively when writing these applications, because we want to know what is possible in your state or your tribe, which can only come with collaboration and cooperation. And then folded down at the bottom here is explain how you will follow up after ER discharge or follow up from an inpatient unit. So I think that this is probably about the 8th time that I've talked about how important follow-up is. And for the continuity of care of your grant, you have to be able to show how you're addressing these at-risk youth once they've been discharged or after they've left an inpatient unit. And remember that you're only going to be able to get those numbers, get these names of youth, and how you're going to follow up through your surveillance data, so making sure that one feeds into the other. Section C is your proposed implementation approach. It's described on pages 25 and 26. And this is how are you going to do what it is you just said you would do. So explain the purpose and rationale and how you will reach your goals. This is where you're going to list your goals and objectives and how you feel your program is going to do all of this necessary work of suicide prevention. You'll provide a timeline of milestones and responsible staff. This is just what it says, the timeline that you think you're going to be able to accomplish all these, the milestones of your grant, and each of the staff members that would be responsible for these milestones. The estimate of unduplicated numbers served by your program, and how you will impact your state or tribe at a system-level change. And this is really going towards the sustainability aspect of your grant because, remember, sustainability starts with your application process, and system-level change is sustainable. So how is this grant going to impact your state or tribe system? If you are a previously funded GLS grantee, we need to know how you will build on the previous work. This is not simply to continue work that's already been done with your GLS grant. And again, as Dr. McKeon mentioned earlier, that we're only able to show an impact a year after the grant has left an area, a year after trainings have been in a specific community. So how are you going to build on that so we can show an impact? How will youth and consumers have input into your program? How will you partner with other SAMHSA-funded projects in your community? And again, you can go on the SAMHSA website and see the grants that are funded in your state or your tribe and how you will work with them. How will emergency care be assured for your youth at immediate risk? So how are our most vulnerable going to receive care, and how will the grant assist in that? How will you follow up on referrals? How will consent be obtained? Who are your partners, and how are you going to sustain all of these activities? Section D is your staff, it's their organizational experience. This is described on page 27. So this question is, why are you the best suited to do suicide prevention in your community? You're going to go through the system level change that we've already discussed, perform intensive community work. You must incorporate substance abuse prevention and treatment. Does your staff have the experience to be able to incorporate these other prevention techniques? And again, follow up with your inpatient and ER discharges for suicide attempts. Is there the capability to do that? List your staff positions, their roles, qualifications, and level of effort. The other resources that are available in your community to do this work. Remember, we have said that this is a community effort through collaboration. So who else is available in the community to do this work? And you must ensure that of compliance with the ADA accessibility. Section E is your data collection and performance measurement. It's described on page 7. You're going to document your ability to collect the required data. So all of the data requirements that are listed in the grant, how are you going to be able to do that throughout your state or your tribe? What infrastructure is in place to be able to collect this? Explain how you will use data to improve your program over time. This is a big requirement of the GLS grant and the redesign. So you can use child fatality review, or if your state collects for the NVDRS, another data point that would inform your program. Describe how you will conduct the local performance assessment and measure your impact. So in addition to state level or national level data points, how are you going to do your local assessments, and how is that going to be able to show an impact, which goes to how you're going to create policy, how you're going to measure policy change and work with your state or your tribe to push suicide prevention and impact in suicide prevention in your state or your tribe. And you also document your ability to participate in the national evaluation, which was already mentioned. For your supporting documentation, this is section F, G, H, and I. You'll have literature citations, your lead agency description. Remember, if you are a private entity that is applying on behalf of the state, you have to have your letter of commitment from the state that identifies you as the agency that the state recognizes. You'll have section H, which is your biographical sketches and job descriptions, and section I, which goes into the participant protection and confidentiality. Remember, again, that GLS requires active consent for their participant protection. Here's the SAMHSA guidelines for assessing cultural competency. You want to make sure that your staff and the language, the community representation is all representative of the particular community that you are working with on your grant, and that the training materials and data collection will be culturally competent. Here are some resources for your grant. There's resources for grant writing that is located on the SAMHSA website, developing competitive SAMHSA grant applications, the guidelines for cultural competencies that we just mentioned, and then the National Registry for Evidence-Based Programs and Practices, which was also mentioned earlier. The SPRC resources that are available, we have the SAMHSA grantee pages, which you can look at other states and tribes that have been funded through GLS. There's also state data sheets, which will come in handy when you're getting your data for your application. You can also browse through the SPRC library, which has multiple resources, and then the Best Practices Registry for Suicide Prevention, which I mentioned previously. There's also data-driven planning models, online workshops, and assessing and managing suicide risk is also located on the SPRC website. Some of the data sources that we mentioned earlier is the Youth Risk Behavioral Surveillance System located on the CDC website, National Violent Death Reporting System, also on the CDC website, and the Web-Based Inquiry Statistics Query and Reporting System, or WISPERS, which is on the CDC website. So a quick summary of the stuff that we've gone through today. For creating your proposal, you want to think about a public health approach. How are you going to access youth and where they live, where they're receiving help, where they hang out. Think strategically about your goals and take steps for successful attainment. So emphasis on that early identification of youth at risk. Are adults ready for youth to disclose their suicidal intent, and who would benefit from your Gatekeeper training? How developed is your response capacity? And suicide prevention is everyone's responsibility. So how will a cross-system referral network be developed or enhanced? Your local evaluation, what's going to be feasible to measure? Always include local data and recent citations. Utilize your data information about deaths and attempts to both target efforts and demonstrate impact. Ensure that the program plan, methods, evaluation design, and staffing are culturally competent. And remember, we gave you the website for that. And as mentioned before, sustainability begins during your program application. So how are you going to engage the people that you need to make the impact we're requesting, and how are these relationships going to be sustained even when GLS funding is no longer available? When you're writing your proposal, make sure you use the language from the RFA. If it's mentioned in multiple sections, remember you can mention it in multiple sections for your response. Have achievable goals, and give honest feedback and revise. Make sure you're working with your partners on this and have their feedback on what you've proposed. Your point of contact here at SAMHSA for this RFA are myself, and my phone number and email are listed here, and Dr. McKeon, who spoke earlier. We're available for program questions. And then Gwendolyn Simpson, whose email and phone number are listed, are available for help with any budgetary questions. There's going to be a recording of this on SPRC's website. It will also be available on the SAMHSA website if there was any information that you would like to hear again. And now we are going to open the line for questions.
Thank you. And once again, if you would like to ask a question, please press *1 at this time. Be sure to unmute your line and record your first and last name clearly when prompted. Once again, if you do have any questions, please press *1 at this time. One moment to see if we have any questions in queue. We do have some questions coming in. One moment while I gather that first name. All right, and our first question comes from the line of Chris Maxwell. Your line is now open.
Hi, this is Andy Brown with Headquarters, Inc., and my question was, when you were talking about the new quarterly reporting requirements, you mentioned that they needed to be linked to GLS funding for qualifying purposes. Can you go over a little bit more in depth what the difference is going to be between measuring effort and dollars in that regard?
I'm not quite sure I understand your question.
Well, so in the new quarterly reporting requirements, you had mentioned that in order to indicate policy change or impact that we've had on policy, we needed to make sure that those were being driven by the GLS grant.
In this, okay.
Right, and so I'm trying to determine whether or not effort from staff or collaborations that we produce as a result of the grant would count, or if it has to be something that's directly being done by dollars that are provided by the grant.
Dollars that are provided by the grant.
Okay, what about subrecipients?
That if the subrecipient receives dollars provided by the grant, then that would count.
Okay. But a partnership that maybe includes 4 or 5 agencies and only one of those is GLS funded, that would not count?
Are they a part of your coalition? They could be.
If it was a new collaboration as a result of the grant, then you would count that collaboration. If GLS dollars were paying for that collaboration to be developed as a result of that grant, then yes, you would say this was a new collaboration as a result of your grant.
I think that the general principle here is that we don't want the grant to basically, we want it to be real. And we recognize that there may be times that grant activities have indirect impacts. And if you were fortunate enough to get the grant, there may be, things that were kind of in a gray zone, in which case you'd be welcome to consult with your project officer about whether it would be appropriate to count or not. But the intent behind this is basically, to not count things that had nothing to do with the GLS grant as being an effect or impact, of it. So sometimes it'll be clear-cut one way or the other. There may be times it'll be in a gray zone, and you can consult with your project officer, about that.
Okay, thank you.
Thank you. And our next question comes from Patricia Reedy. Your line is now open.
Thank you. My question is real specific. When I read the grant, it looked like what you said, that 5% had to go to institutions of higher education. And my question is, does that 5%, do you guys care whether that 5% comes from the 85% that is direct service or not?
It can't. So the 85% to direct service is its own entity, and then 5% would go to an institution of higher learning.
So I'm not trying to sound manipulative, but what if we had in mind direct services to institutions of higher learning?
Does that add up to 90%? If as long as the 85% is going to direct services, and then 5% goes to your institution of higher learning.
Thanks. That's real clear.
Thank you. And our next question comes from Sean Jimerson. Your line is now open.
Thank you. I have just a couple of quick questions. We're considered an urban Indian health program, and one question that came up, or one point that came up, was the issue of private agency. We're also a nonprofit 501(c), obviously. And you would need assignment by the state was one of the comments that was made. Would that apply to us as an urban Indian health organization, urban Indian health program?
You need assignment from the state if you are applying for the state. So each state can only have one. If you are applying on behalf of the tribe, then you would have a letter of commitment from the tribe.
Okay, and then I do have another question. Regarding the 8515 or 85510, are indirect costs permitted to be charged to the grant?
Your indirect costs, yes.
Yes, okay.
And let me just say something about the 85%. That's not a SAMHSA stipulation. It's something that is written into the Garrett Lee Smith Memorial Act. And really the intent of that from Congress was to make sure that the dollars in the Garrett Lee Smith grants, ultimately got in significant measure to programmatic activities designed to prevent suicide among youth. So that is, so it's a feature of the law, which is why you don't see it in other SAMHSA grants, because it was a specific part of the legislation, the Garrett Lee Smith Memorial Act, that created these grant programs.
Okay, and then I have one last question. As it relates to the official documentation that all mental health substance abuse treatment provider organizations participating in the project have been providing relevant services for a minimum of 2 years, what is the evidence that you require? Do you accept only licensure from the state or JACO or one of the others, or what is the necessary component we have to submit?
That's a really great question. I am not sure on the answer for that. So if you could email me, this is Chrissy James. If you can email me at the email address I had listed, I will get back to you about that.
Yeah. So there are two things that there. If we so there is a statement of assurance.
Right.
And so is your question about what constitutes, because the language of the statement of assurance is, I assure SAMHSA that all participating service provider organizations listed in this application meet the 2-year experience requirement and applicable license, accreditation, and certification requirements.
Yeah.
So that could typically be state Department of Mental Health licensure in many states. There are a variety of accrediting organizations. So I think that you would submit whatever you had that was relevant for those particular programs. One thing we would also bet you do that when you look carefully at the language of the RFA, that one of the things that we've tried to move to was originally in the Garrett Lee Smith grants, it was sufficient to be linked to mental health services, and obviously vital to do so. But one of the things that the references to Goal 8 and 9 of the National Strategy for Suicide Prevention, it basically means that the mental health programs that you refer to ideally will be incorporating the objectives that are part of that goal, and they can be part of the grant with you in that regard, because SAMHSA is really working to promote suicide safer care in mental health programs, and as defined in the national strategy. So those are things that anyone on the call, if they're not familiar with, may want to be investigating further by looking at the National Strategy for Suicide Prevention, or looking at the Zero Suicide website that's part of the National Action Alliance for Suicide Prevention website.
All right, thank you. And our next question comes from Linda Weinberg. Your line is now open. Ms. Weinberg, your phone may be on mute. Okay, and our next question comes from Barbara Underwood. Your line is now open.
Yes, I just need some clarity. The RFA I have says goals 8 and 9, but y'all mentioned 6 and 9. Is that correct?
I'm sorry?
No, I said, if I said 6 and 9, I meant 8 and 9.
Okay. All right.
Goal 8 is to make suicide prevention a core priority in healthcare services, and Goal 9 is to promote effective professional practices. So those are the two that we particularly emphasize, although the entire national strategy, of course, is relevant.
Okay, and then some clarification on the statewide or tribal suicide prevention plan. We're a tribal program, but we just have to submit either or, right? Okay, all right. That's all I need to know. Thank you.
Thank you. And our next question comes from Kurt Burns. Your line is now open.
Hi, Richard and Chrissy. This is Kurt. And my question, going back to the first question where the fellow was asking, how we're supposed to attribute, outcomes to particular activities in the grant. And, this whole problem of attribution and cause and effect is quite a challenge in program evaluation. So particularly in these kinds of things where you have these collaborations, you have lots of different moving parts. And so trying to pin down, a particular outcome to a particular input is really challenging. What are your expectations around that, really? Can you give us some detail there? I mean, my problem, this is my concern, my fear, there's often unintended consequences, and also, when people get together, certainly some of the GLS funds are going to be part of it, but it's the getting together that's not GLS funds that's really going to be the big thing, right, the big cause. And can you talk about, what your expectations are for reporting on these complex cause and effects situations?
Well, we're not expecting randomized controlled trials to definitively show causality. And if you're able to show evidence ultimately of reducing deaths and attempts, then we'd be glad to have conversations about what actually was contributing to that. So there are these reporting requirements, and we do want them to be real. But in terms of what is actually most important, what's most important is that people in states and tribes are getting together, public and private partners, in a cooperative effort, utilizing data, implementing activities, evaluating their effectiveness based on whether they're making a difference in terms of deaths and attempts, and continuing to trying to get better. And if you're doing that, we will be there shoulder to shoulder with you, and we'll figure out any of the, the specifics about who exactly caused what. So in terms of what we're really interested in, that's what we're really interested in, and we'll certainly work with you to clarify what counts and what doesn't. The issue is that we don't want people taking credit for things that they had nothing to do with, or that happened completely independently, of it. So just as an example, a number of states have passed laws that are requiring training either by educators or in suicide prevention, or in a couple of states, healthcare providers. Our grant dollars can't be used to advocate for any state legislation. That would be an example of something that, while it may be very relevant for suicide prevention, and where there might have been people in the coalition who were very involved in getting that done, that would be something that the grant really shouldn't be given credit for. There may be other things that you said may be open to interpretation, and we would work with the grantees with them, around that. So I think the most important thing is a focus on what do you think in your states and tribes and tribal organizations, what do you think can work to reduce deaths by suicide and suicide attempts, and how would you be able to get a handle on that? And you should go with what you think is best. Clearly you want to take a look at the language of the RFA and tie us closely together. But in my judgment, you're much better off going with what you think is best, what's going to have the best impact, and then trying to frame that within the language of the grant than to try to focus on the language of the grant and allow that to drive how you design what you think needs to be done. So those are just some thoughts.
Beautiful. That's exactly what I was hoping you'd say. Thank you.
Thank you. And currently I'm showing no questions in queue at this time.
Good. We'll wait 2 more minutes in case a last-minute question comes up.
All right. And as a reminder, if you'd like to ask a question, please press *1 at this time. And one moment, it looks like one question did pop up in queue. All right, and that question comes from Teresa Humphreys Wadsworth. Your line is now open. Please check your mute function.
The question I have is regarding allowable percentage for program and performance evaluation. Is that 10 to 15% of the total grant award? Is that separate from amounts awarded to institutions of higher learning? Help me understand that, please.
Separate from the amounts for the institutions of higher learning, is that your question? It's the evaluation money?
Yes, thank you.
It does not have to be. Some of our grants do use their 5% to go towards an evaluator located at an institution of higher learning.
Okay, thank you.
All right, thank you. And we did have some other questions come in. The next one comes from Brandy Pouncey. Your line is now open.
I have a question about the page limit for the project narrative. In the RFA, it says sections A through E in the narrative could be 30 pages, but on the presentation, it said that A through D could be 25 pages. Could y'all clarify that, please?
Sure. Give us 1 second. Yeah, on page 21, it says 30 pages. So you were correct. It's 30 pages.
Sorry about that.
I apologize for that.
Thank you.
Thank you. And looks like we did have some other questions come in queue. The next one comes from Debbie Trader. Your line is now open.
Thank you. I am 30. But one of the questions we had is that we intend to work with 3 sub-state areas to do our grant, and which we've done before with other GLS grants, and we do anticipate getting strong commitments prior to the submitting of the application, but is that absolutely necessary? We'll have the state's letter of commitment easily, but as far as these sub-grantees, that might be a little bit of a push. Is that something we would still need?
You need the state's letter of commitment. Your sub-grantees' letters of commitment are encouraged but not required.
Okay. We will have pretty good, I'm trying to figure a way to say this correctly. We will have a good understanding of which communities we're going to be working with on this because of the zero suicide work that we're doing in the state. So, but we just may not have the letters in time. So that's what I wanted to ask about that. And then I sent you an email already. For some reason, I could not get into the meeting today. I don't know if it was full or what. But I just sent you an email. If I might be able to just email you my other questions because they're just basically technical things.
Sure.
Okay, thanks. I'll send those off to you.
Okay, great. Thank you. And,
thank you.
Teresa Lai will these slides be emailed out? They will be available on the SPRC website. They will also be available on the SAMHSA website, but they will be posted to SPRC first.
Okay, great.
Thank you. And our next question comes from Let's see here. Actually, let me go ahead and gather that name for you. One moment. Anastasia. All right, the next call comes from Trina Anastasia. Your line is now open.
Oh, well, I'll let you answer. Great. So we're in Wyoming and we're doing the math here, and because we got dinged on one of our applications because we didn't have an FTE associated with the implementation of GLS. However, when we look at the math, if that administrative cost isn't attributable to direct services, and you're looking at realistically 10% of the grant funds for evaluation, having a 5%, even if you were to get fully funded, wouldn't even fund half of an FTE up here in Wyoming. So we're just trying to do the math, and we're struggling with how we would implement this with those restrictions.
Your salaries would be part of direct services.
Okay, that really was my question. Thank you.
Okay.
Thank you. And our next question comes from the line of Scott Perkins. Your line is now open.
Hi. I was just wondering, there was a slide during the presentation focused on Section B, and in that it mentioned logic models. However, it appears from the RFA that logic models are not required. So I just wanted to double check on that and confirm whether.
Correct, Scott. You caught us.
Okay.
We encourage you to have a logic model for your program. However, you do not submit a logic model with your application.
Okay. Very good. Thank you.
We'll probably ask you about your logic model, though.
Great.
Thank you. And our next question, we do have a follow-up from Patricia Reedy. Your line is now open.
Thank you. I want to make a statement because I don't know how to turn this into a question. We're supposed to focus on goals 8 and 9, which is great. Goal 8, I think, has 8 objectives, and 9, I forget, may have 5 or 6. I'm assuming that if we incorporate a few of the objectives under both of these goals, that's okay. We don't have to dot point all of the objectives under each goal. Am I right?
Yes, you're correct. I mean, the thing to remember is that these will be looked at by independent reviewers, and what they will do is they will take the language of the RFA and they will look at your response, and they will score it based on how strong they think that is. You know, so I don't believe we have any language that explicitly says that every objective in goals 8 and 9 must be implemented, and some may not be appropriate for a grantee to do. Remember, the goals were written to influence a nation as a whole. So that would be the quick answer is no, you do not need to feel responsible for writing something for absolutely every objective. And one thing to be aware of, if you look at the Zero Suicide website, you know, that can give you some examples of how some current grantees and others have been working to incorporate what's in Goal 8 and 9. Even there, it's not every single objective in Goal 8 and 9. So you have to determine what's going to be most effective within your state. The most important principle there is that we think that effective suicide prevention requires a strong community component, but it also requires a strong healthcare component, and that needs to be part of the thinking for states and tribes.
Thank you. That's what I thought, but I wanted to be sure. And we had one other question, if I may. The doctor who was here had to leave, but she had a question about self-injurious behavior. As I'm sure you know, sometimes it's difficult to tease out whether some self-injurious behavior had a suicidal intent or not, and she just wanted to know if you guys had anything to say about suicide attempts versus self-injurious behavior.
Well, I mean, that's a great question, and what I would say is that I don't think I would worry about that too much because, I mean, the things you need to do about non-suicidal self-injury compared to suicide attempts, and you're absolutely right that the only difference sometimes may be in the intent of the person, and it may be hard to be clear about that. So, for example, there's a heavy emphasis in the RFA regarding care transitions. So youth being seen, being discharged from inpatient units and emergency departments. You know, if somebody is in because they cut themselves or for an overdose and they're being discharged, if you set up a program to work with folks that I would not be concerned if, you know, you ended up working with a couple of people who turned out to not have suicidal intent. If you were doing the basic work, because sometimes it's hard to know, you wouldn't do this. You wouldn't set up a separate program solely to focus on non-suicidal self-injury as part of this grant, most likely. I mean, it could be a very useful part of an overall coalition and could be relevant. So hopefully that helps. So you don't need to really worry about excluding them from efforts like trying to make sure that youth at risk get followed up after care. The one other thing I would say about that is that the evidence is clear that youth who engage in non-suicidal self-injury are also at elevated risk for suicide. You know, so they are certainly appropriate to, you know, just as youth who suffer from major depression or have substance use disorders put them at a higher risk level. So from that perspective, they could be included.
Thanks. It makes a lot of sense. Thank you.
Thank you. Another reminder, if you'd like to ask a question, please press *1 and be sure to unmute your line and record your first and last name clearly when prompted. Our next question comes from Carolyn Meredith. Your line is now open.
Hi, good afternoon.
Good afternoon.
I'm just seeking a little bit of clarity. On page 7 of the RFA, the third bullet talks about grant-funded initiatives, that they don't have to be proposed for every locality or municipality, but that if there's a specific focus on a specific geographic area that's being focused on, that the rates of suicide attempts or suicide should exceed the national average, as opposed to the state average, is my question. Hello?
Yeah,
we're looking at page 7 right now.
Okay.
Yeah, so the way it's written, it would be the national average. We did try to write this to maximize flexibility. There is language in the Garrett Lee Smith Memorial Act about it's with higher rates. So we did, but we did try to modify the language to say areas, regions, or populations with rates of youth suicide attempts or suicide. Okay, so that means that you could look at it either regionally, or in terms of a particular target area, like youth being seen in emergency rooms, or LGBT youth, or Latina youth attempting suicide, et cetera. So what you basically want to do is to make a case based on risk for whatever you're going to do, okay? And if you choose to do something in a locality, we want you to be thinking about how, if it's successful, it can be integrated throughout the state if you are a state ultimately, so that it can be sustained over time. But we do want you to justify your choice of a locality based on risk. And And I think we used to have language, I think, on suicide rates and numbers, but I actually don't see that here at the moment, because you could have in a, so for example, thinking of an applicant, I presume, not on the poll because they have a current grant. I think it's a state like Pennsylvania. State like Pennsylvania would have in the city of Philadelphia more youth suicides, but a lower rate compared to other areas. So we had tried to allow some latitude for that. It looks like that's not in this particular language. So if you're wanting, so what I would suggest would be if you're wanting to do something and you're not clear about how you can justify it during this language, you can certainly contact us, and we will talk with you about that. But our hope would be that by talking about populations, presumably that you had a particular reason for picking, this. And you certainly can cite and should cite data comparing it within your state.
That's helpful. Thank you.
Thank you. And currently I'm showing no additional questions in queue at this time.
All right, well, let's give people 2 more minutes and see if any other questions come in.
Once again, that's *1. All right, I do see a follow-up from Patricia Reedy. Your line is reopened.
Hi, thank you. I actually wanted to follow up on the previous question that you just answered. So I just want to give you a hypothetical. And I was very glad to hear the clarity so far. But so what if we have an area of the state that is like in maybe the 45th or 49th percentile in terms of suicide rates, but there's far more suicides and suicide attempts in that area, even though the rate is lower. Would we be justified in targeting that area?
Based on what you said, yes, you'd be justified, and you would put that justification in your application as to why you picked this population. But also, please remember that these applications are graded by independent reviewers, so your justification for your populations need to be listed.
Yes. Thanks very much.
And so ultimately, and Christy's exactly right, ultimately it'll come down to whether you're able to make a persuasive case for the reviewer, who will look at this language. But if the reviewer is persuaded, then then you will be fine. That's ultimately, so you always want to make the strongest case possible for what you want to do, being aware of the language. But these are people looking at it. They'll look at the language, and it will ultimately come down to whether it really makes sense for them and whether you've been able to persuade those reviewers.
Okay, thanks a lot.
Currently, I'm showing no questions at this time.
Kurt, thank you very much for your compliment about this pre-application webinar. That was very nice that this is the best one you've been to. Okay, well, thank you so much for attending, and please remember that as you're writing your application, if you do come across questions, you're welcome to contact us. Anything programmatically, you can contact Dr. McKeon, or you can email me. Anything about your budget, please make sure that you email Gwendolyn Simpson, and all of the contact information will be available on the SPRC website as soon as the webinar posts. Thank you again for attending, and good luck.
Thank you. This now concludes today's conference. All parties may disconnect. Speakers, please hold for post-conference.